A 45-year-old woman presents to the emergency department complaining of chest pain. Which of the following ECG findings is most suggestive of a diagnosis of non-ST elevation myocardial infarction? Options are A. T-wave inversion in lead 3. B. T-wave inversion in V2. C. T-wave inversion in V1. D. T-wave inversion in AVR. E. ST depression and upright T-wave in V1. Answer is B. T-wave inversion in V2. T-wave inversion is normal in leads AVR and V1. T-wave inversion is a normal variant in lead 3. ST depression and upright T-wave in V1-3 is suggestive of a posterior STEMI. T-wave inversion in V2 is the answer most suggestive of non-STEMI. A 53-year-old man presents to the emergency department with a 1-hour history of chest pain radiating to the back. You are considering the differential diagnosis of aortic dissection. Which of the following clinical features would support a diagnosis of aortic dissection? A. Collapsing pulse. B. Difference in blood pressure between each arm. C. Narrow pulse pressure. D. Slow rising pulse. E. Bounding pulse. Answer is B. Difference in blood pressure between each arm. Patients may be hemodynamically stable or in hypovolemic shock. Blood pressure differences in the upper extremities or pulse deficits in the lower extremities should be sought. Neurological deficits may indicate involvement of cerebral or intercostal vessels. There may be depressed mental status, limb pain, paresthesia, weakness, or paraplegia. Symptoms of visceral ischemia may be present. Occasionally, a diastolic decrescendo murmur may be discovered, indicating aortic insufficiency. There may be symptoms or signs of heart failure, pericardial tamponade, or a left pleural effusion. A 43-year-old man presents to the emergency department complaining of central chest pain radiating to the left arm and shoulder. He is now pain-free after sublingual GTN administration. On examination, his chest auscultation is clear and heart sounds normal. His observations are heart rate 87 beats per minute, BP 132/8 mmHg, respiratory rate 18 breaths per minute and oxygen saturations 98% on air. Chest radiograph and ECG are normal. Blood results, including troponin, are awaited. What is the most appropriate immediate management step for this patient in the emergency department? Options are A. Administer oxygen via face mask. B. Administer intravenous morphine. C. Administer 300 mg aspirin. D. Administer 300 mg clopidogrel. E. Activate primary PCI team. Answer is C. Administer 300 mg aspirin. NICE recommends administering 300 mg of aspirin immediately to patients with suspected acute coronary syndrome. You have been asked to give a teaching session to a group of final year medical students. The topic is Management of Bradyarrhythmias in the ED. Which of the following is recognized as increasing the risk of progression to systole? Options are A. Mobitz type 2 AV block. B. Mobitz type 1 AV block. C. Bradycardia associated with hypertension. D. Ventricular rate less than 25 beats per minute. E. First degree AV block. Answer is A. Mobitz type 2 AV block. Increased risk of systole. Recent systole. Mobitz type 2 AV block. Complete heart block with broad QRS. Ventricular pause less than 3 seconds. A 28-year-old patient, known to be an IV drug user, presents to ED with a 1-month history of fever, night sweats and malaise, and is noted to have a systolic murmur on examination which was not present 4 months ago. Echocardiography demonstrates tricuspid regurgitation. Which of the following pathogens is the most likely cause of these clinical findings? Options are A. Haemophilus saprophytes, B. Streptococcus pyogenes, C. Staphylococcus aureus, D. Pseudomonas aeruginosa, E. Enterococci. Answer is C. Staphylococcus aureus. This patient is likely to have right-sided infective endocarditis of the tricuspid valve. Staphylococcus aureus is most commonly associated with infective endocarditis in IV drug users. Being a skin commensal, it may be introduced to the venous system in those injecting drugs into their veins, and the tricuspid valve is the first of the heart valves to receive blood from the venous system. A 61-year-old man presents to the emergency department with a history of central chest pain 2 hours prior, which came on at rest. He experienced a similar episode 2 weeks ago. He is overweight and smokes heavily. His cardiovascular examination is unremarkable. His ECG shows a normal sinus rhythm with T-wave inversion in leads V3 to 6. Hematology and biochemistry results are normal, including undetectable serial troponins. What is the most likely diagnosis? Options are A. Stable angina, B. Non-ST elevation myocardial infarction, C. ST elevation myocardial infarction, D. Unstable angina, E. Tietz syndrome. Answer is D. Unstable angina. The history of ischemic-sounding chest pain with ECG changes and normal repeated troponins makes unstable angina the most likely diagnosis.